guys, it's Carisa. It's been a while. I feel like I say that every time. I made a vlog yesterday regarding some new developments in our efforts to conceive, and it was just way too lengthy. I think because it had been so long since I made a video on this channel, I felt the need to kind of recap some things and rehash a lot of stuff, and it's really unnecessary. If you don't know about my recent pregnancy and miscarriage, I have videos about that I will link below. And as far as the future goes, there's probably a lot going to happen, but I don't know what any of it is yet or when that will be. So there's really no sense in making a big long video that my schedule barely permits me to edit at this point. So I thought I would cut it down and make it short and sweet for you and just let you know that I am still seeing the new gynecologist that I've been going to. I think it was the third or fourth time that I've seen him, and that was yesterday. And they checked my blood pressure. It was very, very good. It was like 113/68. It's never that low. That was awesome. And they remarked that they were satisfied that I had lost a few pounds also, one of the nurses. And when the doctor came in, he basically said, "You're just here to discuss some of your lab results." He had tested me for a whole slew of issues that typically are related to repeat loss. Even though my first loss, it wasn't a true pregnancy, it was more like a chemical pregnancy from the IVF. So he at least wanted to prevent future suffering if it was possible and test me for a bunch of things. And I came up fine on everything except for one of the blood clotting disorders that he tested me for. And my number was slightly elevated the first time, and then it was higher last week after 5 weeks. So it was a 13 the first time, which is kind of on the cusp of normal or elevated, and then it was a 21 last week. So he said that the number isn't so astronomically high that he believes it had anything to do with our history. It is likely something that I've just developed and that may not be an issue in the future, but at least they know about it now, and that he thinks at this rate a baby aspirin is all that would be necessary to prevent that. And that's already a precaution that I take during a cycle if I think I have a chance of conceiving, which is what I did the first time when I conceived in February. He did ask me what our next steps were. I did tell him that at some point I am interested in speaking with one of the contacts he's offered me in a few major cities, that we would be able to, he said, have our measurements done in his office to a certain extent, and obviously have to travel there for some of the things that they would prefer to do in person. But he gave me the number of the closest doctor to us geographically, so that hopefully when we are ready to make that step, we can have an initial consultation appointment and just kind of get a feel for the place. And if it isn't a good fit, or if we don't care for them for whatever our own reasons are, we have some other options. But he does think that at this point I should be discontinuing treatment with any of my former clinics, just because he thinks that I've probably reached my full potential with any of them. And he says that there's nothing wrong with any of those places, but he thinks that I should go a more progressive route in the future. So that's pretty much everything. I don't know why I talked for 30 minutes yesterday, when that's all I have for you, really, to tell you. Today I had to see my primary doctor as a follow-up to my blood pressure medications, because those were changed when I became pregnant because my levels were still too high for what they were comfortable with for pregnancy, but they wanted to have me on the safest drugs possible. I do have a follow-up with that doctor in August, even though he wanted to see me as a third trimester appointment, and it will not be. I'd rather still just go and have him make sure everything's okay and that I don't need more or less of a dose. So everything's going pretty well as far as that's concerned. I did talk to my doctor today about sometimes feeling like my sleep is very, I guess I don't really know how to explain it. Sometimes it just feels very aggressive, like it's not super restful or productive, mainly because I have bad dreams a lot of the time. But she said that there is a possibility that if I had sleep apnea, it's aggravating my blood pressure levels a little bit. So there is a very real possibility that I will be taking a sleep study soon. I know I should do it. I know I've always needed to do it. I've just put it off because, I mean, I don't think I have sleep apnea. To be 100% honest with you, I really don't think I do. But I think it would be wise to just be tested for it, because it is breathing after all. I should be doing it. But that's everything. We are tracking more than we used to in the past. I'm doing a pretty full routine of tracking, but it's more so just to make sure that I have a good idea of what my cycles are like and how regular I am, and just trying to pay attention to what's actually going on as far as my own personal cycle history leading up to treatment. I'm not really sure when we'll be pursuing IVF again, so as far as regular monitored cycle updates, I don't see that in the near future. But anything else that I have going on, I mean, I don't know if you guys want to know what supplements I'm taking or anything about, I don't know. I guess I don't really know what I would talk about on this channel. That's why I don't do it very often. But if you have requests for me, certainly leave them below. And thank you for sticking with me and for still being subscribed and waiting for the day that I have something to post. I really appreciate that support. And I know a lot of you have followed me over to my other channel, which, you know, as I've said a million times before, is a wonderful distraction from a lot of this. So thank you so much. I will talk to you guys soon. I hope you're all doing well. Bye.